study out this morning adds to concerns about some common painkillers. The research is reported in the British Journal of Clinical Pharmacology. It looks at prescription non-steroid anti-inflammatory drugs. So think of prescription strength ibuprofen and naproxen. Doctors call them NSAIDs. People taking the pain relievers had an 18% higher risk of irregular heartbeat. Earlier studies linked over-the-counter NSAIDs to a bigger chance of heart attacks and strokes. Our Dr. Narula is a cardiologist at Northwell Health and joins us at the table to discuss. Is this as scary as it sounds? Because I know a lot of us take naproxen.
Right. Well, it's important information for people because these are commonly used drugs. Things, as you mentioned, like ibuprofen, naproxen, Celebrex, that we use for arthritis, headaches, muscle joint pain. But in this study, what researchers did is they looked at about 50,000 middle-aged Taiwanese individuals who reported using prescription doses of NSAIDs. And they looked to see if there was an increased risk of atrial fibrillation, which is an irregular heart rhythm. And they did indeed find an association. Now, AFib means the top chambers of the heart beat chaotically. That can increase your risk of stroke and heart failure. Mechanism is behind this, they're unsure. The thinking is that possibly it changes blood flow to the kidneys, raises the blood pressure, causes imbalances in potassium, stretches the top chambers of the heart, and that can trigger the atrial fibrillation.
And this study was conducted on both men and women?
It was, yes, a general population in Taiwan.
And so what is the takeaway for people even taking aspirin? I mean, should people be concerned about something as common as aspirin that people take on a daily basis?
Well, aspirin is in the class of non-steroidal anti-inflammatories, but it is different than some of the ones we're talking about. And so we all know about aspirin for use in the setting of cardiovascular disease. And at those doses, 81 milligrams, 325, there's still an increased risk of bleeding, gastrointestinal bleeding in the brain. But when you're talking about using aspirin for pain and in anti-inflammatory effects, you're talking about much higher doses, like 650 milligrams to 8,000 milligrams. And at those doses, you are really increasing your risk of hearing loss, gastrointestinal bleeding, kidney failure, and other significant side effects.
And that's over-the-counter aspirin that you were talking about just then.
Yes, and so I think we need to be clear about over-the-counter drugs, okay, and in this NSAID class. They also have a warning label on them, okay, that says that they can increase the risk of heart attack and stroke. We know that as a class, this is an effect of these drugs.
Most people don't read their labels.
They don't read their labels.
Read your labels.
However, the FDA says that if you use the over-the-counter NSAIDs as indicated, which means for less than 10 days for pain, low dose, short time, it's generally safe. The problem is a lot of Americans don't read the labels and they don't use them that way. They take their naproxen every day from their pill that they have in their medicine cabinet for years, or they may take higher doses. So it's important to read the labels. But I want to be clear, this study was prescription NSAIDs, not over-the-counter NSAIDs.
No, we should point out from the Consumer Healthcare Products Association, they say this, that the study only looked at prescription medicines and did not include over-the-counter medicines, which are used in smaller doses for shorter durations.
Right, and so that's exactly what we're saying. But in 2015, the FDA required prescription makers of NSAIDs to change their labeling to say they can cause heart attack and stroke. The risk increases the longer you take them, the higher the dose, and that risk can happen in the first few weeks. And they requested that over-the-counter manufacturers change their label. So clearly this is a class effect.
Yeah.
That's why it's important to know about it.
All right.
Read your labels, talk to your doctor. Thanks, Dr. Narula.